it seems like that I should have met Dr. Jones before today, but I hadn't. And it's possibly because we aren't part of the medical home project. But a couple days ago, my daughter was in a play at South Burlington Middle School, which is the school that she goes to, and she went out afterwards with a bunch of friends, including this one little girl that she really likes. And so we went out to this place called Al's French Fries. Anybody know Al's French Fries? Right? It's really good, okay. And so the kids are having a great time together, and we sit down with this little girl's mother, who talks to me about, and this doesn't connect at all, about her husband, who who runs the Blueprint for Health, right? And so she goes on about her husband and the things that he's done, and very lovingly and admiringly. Feeling embarrassed now? Okay, right? So I'm saying, boy, I really hope I get to meet him. So, and I'm still not connecting this, right? So I get this thing, which I am going to read, and I look at it and I say to myself, holy cow, I think she wrote this thing. So if there's any endorsement, for those of us who've been married long enough, that when your wife says all of these things about you, then they really must be true. So that's a small world, big world. So now I'm going to read the remarks, so you can see why Bi-State thinks Dr. Jones deserves this award and why his wife concurs. So, Dr. Craig Jones is being presented this award because of his tireless work towards Bi-State's mission of assuring access to health care for the underserved population. Dr. Jones has a long history of helping those in need and improving health access to vulnerable individuals. When working for the Los Angeles County Pediatric Asthma Disease Program in California, he developed a mobile asthma clinic deemed the Breathmobile that served underprivileged children at more than 120 schools. As a result, in the areas served by the mobile clinic, emergency room visits and the rate of school absenteeism decreased significantly. This is a remarkable achievement, and Vermont is lucky that the doctor decided to make the move to our rural state. And for those of you who have worked with them, I'm sure that you concur. Dr. Jones started work for the state of Vermont in August 2006 as the first director of the Blueprint for Health. The Blueprint for Health, launched by Governor Jim Douglas in 2003, is a state-wide system of care for addressing chronic conditions. The Blueprint is a public-private partnership that includes state government, state insurance plans, business and community leaders, healthcare providers, and consumers. Dr. Jones has played an important role in the healthcare reform across the state and across all stakeholders in Vermont. As Dr. Jones himself has said, the Blueprint for Health is an ambitious, innovative program established to improve the health of an entire state. There is really nothing like this program currently underway anywhere else in the nation, and I'm very excited about the opportunity to lead the initiative and build on the strong foundation already set in place by the Blueprint team. Dr. Jones has developed programs that improve healthy outcomes and lower overall costs. His direct clinical experience with chronic care has been a great addition to the Blueprint Initiative and an integral component to completely reform the healthcare system here in Vermont. While we are pleased to present the Vermont President's Award to him, it's not will not be the first award to grace Dr. Jones's shelves. In 2006, he had received the Outstanding Physician Award from the Medical Board of the State of California, largely for his dedicated work for the underserved children in California. The distinguished award that Dr. Jones is receiving today is meant to signify our gratitude for the important work that he has done and continues to do for all of us. Therefore, on behalf of the Bi-State Board and staff, I'd like to have Dr. Jones come up, and I want to congratulate you and thank you very much for all you have done and will continue to do for us.
First of all, I just want to thank the Board of Directors and everybody for this award. It's a bit humbling, and particularly in an audience like this. This is a group of people that are dedicated to building a safety net, building the best healthcare possible for people who really need it. And I got to tell you, it's an honor to me to be able to work with the people I'm working with here and to be recognized this way. I think there's a lot of other people in this room who have spent their lives dedicated to this and deserve it more. And I just want to say, from the time I've been here, the work with the clinics that we're involved with, you're building a model of care that's not just a safety net, it's a model of care that anyone would benefit from. And I can't congratulate and thank all of you enough for the opportunity to work with you. It just, this approach to healthcare reform couldn't happen without your efforts. It's really critical for me always to recognize the leadership. I mean, the reason I'm here and the opportunity I have to work with all of you is the fact that there is leadership here in this part of the country, in the state of Vermont, that is trying to do something fantastic. And so in Vermont, the legislature and the governor's commitment to this is critical, as it is in New Hampshire. And it's created an opportunity. So I feel honored to have the chance to step into this opportunity and to be part of it. And I have to acknowledge the team I get to work with, Susan Basaya, the head of healthcare reform, who you met and heard from earlier, and Hunt Blair, who she strategically snatched from this organization. This is an incredible team, along with the leadership, to make healthcare reform come alive. And so I want to thank them and all of you for the opportunity and the recognition. I feel like I'm really the one that's gaining the most from this. Thank you.